How's it going, guys? It is 3:52 a.m. Friday, July 15th here in Japan, and we have a medium difficulty question for pathology for step 1 and step 2. Okay, so nearly identical question shows up on one of the offline comp exams for step 1. Okay, so if you have disagreements with this, not my fucking opinion. It's on the comp exam, as I just said. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at mehlman_medical, mehlman_medical. Links down below. Find me on Telegram. Links to the Telegram group and channel down below. Now let's start the clip. 55-year-old man. He's got a 4-year history of increasing muscle weakness. Serum creatine kinase is elevated. He takes no medications. There's no skin findings. Serum titers for anti-nuclear antibodies and U1RMP are negative. Muscle biopsy shows inflammatory cells with basophilic rimmed vacuoles. Question wants to know the most likely explanation for these findings. So let's just whip through the answer choices here. We'll go backwards. Choice C, polymyositis, wrong fucking answer. Now, albeit the fact that we would have increased creatine kinase sometimes, okay? We're not going to have this basophilic rimmed vacuole finding on biopsy, okay? As I prefaced with, not my fucking opinion. This isn't for my entertainment. This is on the comp exam. So you're not going to see this in polymyositis. You would see a CD8 plus T cell infiltrate. Now, when we differentiate polymyositis from polymyalgia rheumatica, and I've made prior clips on this, I've harped on this, okay? You need to know, and PMR, polymyalgia rheumatica, is also the wrong answer, by the way. You need to know that polymyositis will have either an increased creatine kinase or weakness on physical exam. Okay, you can have increased ESR in both. You can have pain and stiffness in both. Okay, and you can have low-grade fever and autoimmune flares for both. But you're only going to have weakness on physical exam, must be on physical exam, and/or increased creatine kinase and polymyositis, not PMR. And of course, you can get dermatomyositis if you have the skin findings, Gotrin papules, mechanics hands, shawl rash, heliotrope rash, and polymyositis, not to be confused with malar rash. And lupus, polymyalgia rheumatica, obviously associated with temporal arteritis. Point is, the wrong fucking answers. Choice C, mixed connective tissue disease, wrong answer. I have never seen this actually assessed as a correct answer on nbme, let alone the fact, very fucking rare to even see it as an incorrect answer, okay? Sometimes resources will mention this. It's non-existent on nbme material. Okay, so in theory, if you were to Google this, this is a condition that will have oftentimes a positive U1 ribonucleoprotein antibody, and it's a combination of LPS, lupus, polymyositis, SLE. So the disease can present as a mix of those three, LPS, lupus, polymyositis, SLE, with a positive U1 ribonucleoprotein antibody. Wrong fucking answer. Choice B, fibromyalgia, wrong answer. It's a psych condition. There's not going to be an increase in ESR, muscle weakness of any kind. It's going to be described as symmetric tender points, okay, on muscles, 12 to 18 symmetric tender points, and you treat this with SSRIs, okay? Antidepressant therapy, even though the patient's not depressed, SSRIs are still antidepressant therapy. I should have mentioned that PMR and polymyositis, we treat with steroids acutely. Polymyositis we diagnose with electromyography and nerve conduction studies, anti-Jo1 antibodies as well. PMR, there's no specific diagnostic test. So our correct answer is inclusion body myositis. Now, as I prefaced with, and as I've already articulated, it's low yield fucking nonsense. Okay, it's not my opinion. So this is on one of the comp forms for step 1, and they're going to tell you that there's a muscle biopsy that shows basophilic rimmed vacuoles. Okay, this is your buzzy finding. I mean, I don't know what else to tell you in the context of also eliminating the others. That's what we've done here. Okay, so that's what USMLE is going to do sometimes. They will give you a question slightly unusual, and if you know these other conditions fairly well, you can begin the process of elimination. And if you know factoidy stuff, that's your knowledge right there, and you can say, yes, the answer is inclusion body myositis. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.